Hello everyone, Kent.Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, a podcast endorsed and sponsored by kidneysolutions.org. Hello everyone, this is Kent.Bressler, and we're going to do some podcasting this morning, and we're going to concentrate on kidney disease, which we've been doing for, I think this will be a session in the 70s, somewhere in the 70s. So we've been cruising right along. Let's begin with prayer. Lord Jesus, be near me in my time of weakness and pain. Sustain me by your grace, that my strength and courage may not fail. Heal me according to your will, and help me always to believe that what happens to me here is of little account, because you hold me in eternal life. Amen. To all you folks that are listening out there, whether you had kidney disease or not, I'd like to just make a few points to you. If you haven't been immunized yet for the COVID, I would encourage you to do that. This coverage is very important to a transplanted patient. We know for a fact that the vaccines are working. Yeah, they've got some side effects, but what doesn't in life? And if you act accordingly, and you yourself who are listening actually do get vaccinated, you're helping yourself, but you're also helping the transplant community and the world in general. CDC recommendations have changed. I'm not going to go into that. You know, as a transplant patient, your obligations to yourself is to protect yourself. We don't advocate anything but protection for you. In other words, mask up in big areas. Outside, it's okay. Use your judgment. If you're going to go to a casino, you're going to go to concerts, you're going to go where there are large groups of people, shame on you, because it's going to be tough for you to stay away from the virus. But use your mind, use your own recognition of your surroundings, and make sure that the people around you have been vaccinated. Know your people, know who's been vaccinated. And that's just all I'm going to lecture you on this morning. If you haven't been vaccinated and your doctor has said that it's a good idea you do it, I suggest you do it right away. Okay, thanks. So this morning, well, it's morning where I am. I don't know what time you'll be listening to this. I want to introduce a gal that I met at NephCure, which is a company that concentrates on FSGS, which is a disease process that I have. And her name is Kristen Hood. She's master's prepared and an RN, and she's clinical outreach director for NephCure. As a nurse with a specialty in patient-centered education, she devotes her time to our community through educational and advocacy initiatives. Kristen enjoys connecting with patients through personal and virtual platforms and is driven to help individuals improve their health outcomes. Kristen earned a Bachelor of Arts degree at Southwestern University in 2001. Then she completed a Bachelor of Science in Nursing degree at UT Health Science Center in 2004. She earned her master's degree in nursing education in 2017, and she is currently, now get this, folks, currently attending Bryan College, and she's in her doctorate work in nursing education. Her nursing background ranges from, as per usual, medical, surgical, neonatal, labor delivery, postpartum, pediatrics, and school nursing. She's well versed. Prior to coming to NephCure, Kristen, as an associate professor of nursing, was a professor of nursing, and then she's a member of Sigma Theta Tau, International Honor Society of Nursing, the Texas League of Nurses, the National League of Nurses, American Nephrology Nurse Association, Women in Nephrology. Kristen resides in San Antonio, Texas, with her husband, Randy, her children, Ben, Logan, and Emma, and their beloved, and I'll never be able to pronounce this, Visla, Copper Sky. Welcome to the program, Kristen. How are you?
Thanks, Kent. I'm great. I'm great. And you almost got the dog breed right. It's Visla. Yeah. He's a Hungarian bird dog. And yeah, he's a redhead, so he kind of matches me and my family too. So
I should have had a picture of him. I would enjoy that. We probably should put that in the web art when we publish this podcast.
Yeah, I'm just as proud of him as the ones that I birthed myself, I have to say.
Listen, I was first of all, I know that you have a son who has MCD, which is minimal change disease. I know that for a fact. Is that correct?
That is. My middle son, Logan, was diagnosed with, when it first started, they don't know what he has, right? They just treat you with high dose steroids. So nephrotic syndrome. And he is steroid sensitive. So he responds to steroids. So the presumed diagnosis is minimal change disease. That is correct.
Okay. So at 8, he's 12 years old. Is that correct?
That's right. He was 7.5 when he was diagnosed. And, he didn't feel good for a while. I mean, that's pretty typical, right? Didn't feel good for a while. And it's unfortunate because right now, whenever I see these memories come up through, different social media platforms that I'm on, I see how sick he was because it started around this time, almost 5 years ago. And so, I see these pictures come up and I thought, oh, why didn't I see this? Why didn't I know? I'm a nurse, why didn't I know this? And we did have a few misdiagnoses. It's pretty typical for the storyline. You've probably heard many people's stories. Oh, it's allergies. Oh, it's a reaction to something. Or it's a sinus infection. He was even diagnosed with an atypical pneumonia. So, it was a tough journey. He had gone on a low dose steroids for what they thought was like his asthma and this atypical pneumonia, right? And so he was starting to feel a little better. Because of the steroids, but it was low dose, and it was like a Medrol pack basically.
Yeah.
And we had been scheduled for a vacation to go see my sister in Tucson. So I loaded the kids up and we went to Tucson. It was just me and the kids. And within 72 hours, he was just writhing in pain, on the floor. I mean, can't hold anything down. It was awful. And I thought he was having appendicitis.
Yeah. Yep.
And I thought, this is what's wrong with you, And so we were rushed to the emergency room and they asked for a urine sample. And Kent, it was about the color of iced tea,
Yep.
And I told the nurse, I said, that's not normal. And she said, well, does his urine not look like that? And I said, well, whose should look like that?
Yeah.
But no one was telling me anything. And my kid is just in so much pain. And it took a while. I finally asked the nurse, I said, is someone going to come in here with a sonogram? Because Kent, still at the same time, I thought it was appendicitis. I thought something.
Sure.
I said, aren't you going to do a sonogram? I mean, I said, he's in so much pain. And she said, oh, has no one come talk to you? I said, no one's come talk to me. So the doctor comes in and he says, okay, who are you? And I said, what do you mean, who am I? And he said, well, you're asking for lab values. You want to know white count. You want to know you want to get a sonogram. Like, who are you? And I said, well, first of all, I'm a mother
of this child. Yeah.
I'm a mother of this child who is in writhing of pain. And I said, and I don't know what's going on. I said, but second of all, I'm a nurse and I know that something's wrong. And he said, okay, you're a nurse. And I said, yes. And he said, well, then I want you to come sit by me and I'm going to show you his lab work. And so he sat me down and he showed me the computer screen. And Kent,
were you shocked?
It was awful. It was absolutely awful. And I thought he said his kidneys basically aren't working. And so the doctor turned to Logan and he said, Logan, how many times a day do you pee? And Logan sat there for a minute and he said, well, maybe once or twice. And I was blown away. I mean, when your kids get old enough to go to the bathroom on your own, you
don't worry about them.
You don't pay attention to how many times they go, right? And
nope.
But you know what I remember, Kent, is, but you still, as a parent, you still say, okay, we got to go here. We got to do this. You better go to the bathroom, like that sort of thing. And he always said, I don't need to go. And I'll never forget that. And so his kidneys had basically shut down at that point in time. It was an acute kidney injury at that point in time. So they were trying to get his kidney function back. So
he listening to this story, the first thing in my mind is go back and tell me when the first time he had a urinalysis done.
It was in the hospital at that moment in time.
Bingo. Is that
Bingo.
not? Isn't that? See, this is going to be fun because not at his expense, but just for the feelings that I went through the same thing when I had my disease process.
Yeah.
The thing of it is that protein in your urine, like you said, ain't supposed to be there.
That's not supposed to be there.
So what's so hard about anyone, any physician, any PA, any nurse practitioner getting a urine sample on everybody?
It should be standard, Kent. It really should.
Hello.
It should. I'll tell you what. So there was I told you he had 2 and 3 misdiagnoses.
Yes.
On the second misdiagnoses, they had put him on like an antibiotic, thinking it was a sinus infection, and it wasn't working. And he was looking worse.
Sure.
And my daughter, turns out a few days after he starts the antibiotic, my daughter doesn't feel well. And I thought, you know what, if I'm going to take you to the doctor, I'm taking him back to the doctor. So I took them both in and I told the doctor, they looked at my daughter. Okay, we're going to take care of that. And I said, but let me tell you something, something's wrong with him. And this antibiotic's not helping. And I don't know what's wrong, but something's not right. And the doctor was really good. In fact, it was a nurse practitioner that we saw. And so she was really good. And she said, okay, I hear you. This is a mom thing. You're telling me as a mom that those hairs on the back of your neck are standing up saying something's not right. And I said, yeah, there's something not right. She said, okay, so I'm going to send you for lab work and we're going to get a chest x-ray too. And Kent, guess what is the one thing that was not on the lab slip?
I know exactly what wasn't. It was the urinalysis.
It was the urinalysis. Everything else was done.
Yeah. How much does a urinalysis cost? $5 maybe? $5?
Yep.
And here's a guy struggling, a little nut struggling.
Yep.
And that's the dread of kidney disease anyway. Most of us go through that. He just got to go through it at a real young age. And that's what MCD or, this minimal change does. It starts really early.
That's right.
They can be there, 7 years old, documented 7.
That's right.
And
that's right.
Because you quote aren't older, they don't do a urinalysis on you. And that costs a lot of people. It's
right.
It's
so You're right. And, I mean, I know as a nurse from that moment when I thought back, when we're in the hospital in Tucson, and I think back and I thought to myself, no one should ever go through this again.
No, not at all, ever.
Pediatricians used to dip urine
in the office.
That's right. They used to. And then because most of the time nothing was there, they stopped doing it. Mm-hmm. And it stopped becoming a standard of care. Mm-hmm. And we've got to get it back into a standard of care. I mean, at 4 years old, they're going to check your eyes and your ears. You might as well test their urine. I mean, a dipstick, you can buy them in bulk. It doesn't take 2 seconds and probably 25 cents a strip to be able to dip that urine in the office.
Yeah. I don't know. That's to me the worst possible scenario for any person with kidney disease is not only a misdiagnosed, but not being able to even diagnose it at all for a long period of time.
That's right.
So you go on being sick. The sickness doesn't go away; it gets worse. Actually, it accelerates as the amount of and nephrotic syndrome takes effect. You get sicker and sicker, right?
That's right.
And a simple 25-cent, $5 test would have fixed that right away. Whoa, he's 4+. He's got 4+ protein in his urine.
Mm-hmm. That's right. That's
Wow.
right. So, and he continued to get sick. And, I remember him not eating well. And I remember his belly getting big. And,
yes.
He was retaining fluid. Mm-hmm. And, and then he started getting, the fluid into his lungs. And they drained in the hospital. I think they drained about 10 pounds of fluid off of him.
Bless his heart.
Because I mean, it was all in his abdomen. I mean, it's a pretty typical,
sure,
story. A lot of people who, are first diagnosed, it is this acute, they don't feel good for a while. But the symptoms are vague, right? I mean, yes. You don't feel good. Your stomach hurts, that sort of thing. And it's only usually when people start to swell up that they go to the doctor. And that's
pretty advanced by then.
It's pretty advanced
by then.
So he had peritonitis, and which was the belly pain that, I thought was appendicitis. That's the other thing. There's a lot of guilt on my part as a healthcare professional and as a nurse and as a mom, for not seeing it. But Kent, as a parent, sometimes you see things through rose-colored glasses, and it's hard to see, through the forest, through the trees, or whatever that saying is, right?
Yep,
but
yep.
I do feel guilty at times. But I know since his diagnosis, I immersed myself with nephrology, and I immersed myself to learn more and to know more so that I could do better by him and maybe even help others. And so that's definitely.
That's what you're doing. And you can beat yourself up. I would have done the same thing. I did it to myself. Okay, because I missed signs that I should have known, but I ignored them because I didn't want to be sick. All right.
Right.
All right. So the point here with him is that you figured it out, and how is he doing now? What is it that after he got diagnosed? What are they doing for it? What's the latest? Yeah. What are they doing for him?
Sure. So, standard of care still to this day is with anyone that presents with nephrotic syndrome, especially in pediatrics, I'm going to say. But this even goes into adults as well.
Oh, yes.
Pediatrics, they tend to take the least invasive path. So biopsy is not standard upon first diagnosis of nephrotic syndrome. So what the standard of care is high dose steroids. He was in the hospital for about a week in Tucson, And because before you start steroids, you have to do a lot of testing to make sure that there's not any underlying autoimmune disease causing it, right? So like
absolutely. Lupus, yep.
They even, they look at HIV, they look at all of these different viral secondary, sources that could cause nephrotic syndrome. So they have to do all of that because if they can treat the source, if they can find out a true source and treat the source of what's causing the nephrotic syndrome, then that's the best, that's the best plan of care. So they do all of that. And of course, these tests take a while to get back. And his all came back negative, no autoimmune markers, no HIV, no lupus, no, all these things.
No infections, no regular infections, no sinus infect. Yeah.
That's right. And so they start with high dose steroids. And so
when you say high dose, tell what do you mean by high dose? How many milligrams of prednisone or Solumedrol? How much were they using?
60 milligrams per day.
That's the standard.
That is the standard. And he was 7.5 years old, probably about 70 pounds or so.
Yep. 60 milligrams.
Yes. And then because he was, kind of in this acute phase, he also received albumin infusions with Lasix to try to help replenish those proteins in his blood, but also get off some of that fluid off of him. So he was in the hospital for about a week. Like I said, he was spilling large amounts of protein, +4. So dark that it was really kind of off the strip when they teach you how to, dip your own sticks.
Somebody thought the stick was wrong.
That's right. It's like, oh, this is a dark green. We don't like the color green.
No.
Syndrome.
No.
He had a lot of edema, obviously swelling in different parts of his body, mostly around, obviously, the eyes, the hands, and the feet. And that can be really painful. Just because of the stretching of the skin and you lose mobility of some of your joints because you get so swollen. He did have high blood pressure. However, as they were giving, they did give IV doses of prednisone initially, and that did help the blood pressure. And his cholesterol was sky high. I mean, you're talking about a 7-year-old who had, a total cholesterol of over 300. And his LDLs were, close to 200. I mean, it was
out of whack.
Completely out of whack. And I remember, when the nephrologist, we were admitted, obviously, from the ER, and in less than 1 hour, the nephrologist was in our room. And Kent, as a nurse, when a specialist walks into a room in less than an hour, something is wrong.
Yep. It's time to do something.
Something is wrong. And so he was there within an hour. Yeah. And I remember it was almost like this tunnel vision. I heard what he was saying, but I couldn't believe what I was hearing. And I remember vividly him telling me, your son is at a high risk of a stroke or some type of, clotting problem.
Right.
And I remember him telling me, if he complains of a headache, he said, I need you to push the call button. And I said, okay. And he could tell that I was still trying to process what he's saying.
Well, you're even though you're our RN, this is your son laying in that bed.
That's right.
And you have not pulled out the books and read about MCD. You have no clue what it is. You're not working with it.
That's right.
So you're actually in a fog. You're saying to yourself, God, what in the world am I going to do here?
A complete fog.
Yep.
Yeah, a complete fog.
Yep.
And so and he could tell I was still kind of processing this. He said, you push the call button. And he said, and if no one comes into the room within 2 minutes, he says, you push the code blue button on the wall. And I looked at him and I said, but we don't do that. Like, as a nurse, you don't push the code blue unless it's a code blue.
That's right.
And so I told him, I said, but we don't do that. And he said, yes. He said, but your son is at such a high risk for a stroke or another type of infarct, is what he said.
Yep.
That this might be what you have to do. And I thought to myself, I'm in over my head. This is my baby.
Yeah.
Someone rescue me, you know?
Oh yeah. Oh yeah. I cannot imagine. And I've had 4 or 5 people that I've worked with MCD, and the mothers say the same thing. What in the world did I do? What did I miss?
That's right.
But let's not beat ourselves up anymore, because he's going to be fine. He's going to work at that.
So he's doing well. The first 2 years he relapsed frequently, but he continued to respond with steroids. You know, that's a double-edged sword. They work, praise God.
Sure.
But they're awful on the body, and they're awful on the mental state of a young child. He went back to school looking very different than when he left school, because remember, this was over the summer.
Yes.
Some of his friends did not recognize him. He had gained, over 40 pounds in less than 3 months. He looked very different. And so I was concerned, what was going to happen socially with him. And so I had a meeting with his teacher. I would text some of his friends' moms, like, hey, just let them know that Logan looks different, but he's the same kid. So Logan goes back to school, and this tells you about the resiliency of children. He goes back to school, and they're at recess, and some of the kids are like, Logan, why do you look so fat? And he said, oh, well, my kidney stopped working, but I'm better. And he's like, come on, let's go play soccer.
Yeah, get on.
My kidney stopped working, but they're getting better. Let's just go, And I thought, I wish adults were as just resilient as children sometimes, So the first couple of years, quite a few relapses, quite a lot of, steroid usage. And then Kent, I'm going to tell you, about 2 years after his diagnosis, he had a secondary, we don't really know if it's secondary, but another, I'm going to say, autoimmune disease. So he was then diagnosed with juvenile psoriatic arthritis.
Psoriatic, yeah.
And so that was kind of a blow. So when he flares with his arthritis, he will spill protein. MCD, there is a autoimmune type of component to a lot of these glomerular diseases. There are components of obviously the immune system kind of attacking your own body, if you want to say it that way. And so whenever he is in a flare with his arthritis, he will spill protein. However, when he was finally got on an immunosuppressant for his psoriatic arthritis. We were finally able to get him off steroids for over a year. He was on them for a year straight.
Right.
And we were able to wean him off of them. And he was started on an immunosuppressant. And once he started that, he has not had a nephrotic syndrome relapse. So we are in about almost a year with no relapse for nephrotic syndrome. And he will and so we think it's not a typical immunosuppressant that's given to glomerular disease patients, but when his nephrologist saw that he was not relapsing as soon as he started taking this particular drug, it's called methotrexate.
Yep.
She said, okay, this is obviously helping him. His kidney function right now has been the best it's been since his diagnosis. So we're going to keep him on it. It's working. So that's where we are. He's doing well. He's a kid. He's 12 years old now. We don't limit him. We never did. Even whenever he was nephrotic and going through those first couple of years of frequent relapses,
let
Logan,
him be a kid.
That's right. Logan, do you want to play baseball? Logan, do you want to play soccer? Yes. Okay. We would sign him up. Yep. He would go to the games. There were some games where he was like, Mom, I don't feel good. Do you want to play? I don't think I can. Okay, that's fine. We never limit him.
Great.
He will tell us when he doesn't feel well, and we listen to him. We listen to him.
Most of the time, these kiddos, I mean, it's a drag down, knockdown feeling. It's beyond fatigue.
Yes.
It's just it's beyond drive. I don't know if there's an explanation for it, but I've heard a couple kids say, I don't want to do anything.
Yeah.
I just don't want to because I can't. The
That's
body
right.
it just shuts down.
And that's how he describes it, honestly. He's like, because I'm like, well, are you tired? He says, it's not that I'm really tired. He said, it's just that it's like I can't get up, like just
somebody's holding them down.
Like a heaviness. Yeah.
That's right.
Yeah.
It's a heaviness. Yeah. That's a great explanation. But you know what? People will say, well, you're just being lazy. You have to be, especially in the teenage years. But that's not the case with kidney disease. A lot of people with kidney disease feel that way, even after transplant. All right. Yes. Let's just be honest here. Kidney disease is an incapacitator. It does not owe anything to anybody. And if you got it, it's progressive. You got to stop.
That's right. That's right. It's hard to describe that level of fatigue to people who don't know it intimately, right?
Yeah, it's true. And people, I've done that at work myself after 20 years as a transplant recipient, sitting at my desk, and I just over for some reason, I just haven't got it. Right. No focus. My mind just slips. I'm tired. I'm fatigued. All I want to do is lay my head down and get 10 minutes of sleep, and then I'm good to go.
That's right. That's right. Just to give yourself a rest and to kind of recharge a little bit. So, so you know what? We listened to him.
Yeah.
And
great.
And we don't limit him. If you saw him today, he looks like any other child.
Yep.
But that's the thing too, Kent, is that people don't realize what your kidneys are doing inside, right? So I gave a talk one time to an auditorium of elementary school kids, and it was about kidney disease. And we were talking about, I taught them, elementary kids, they don't even know what kidneys are. I told them, I got to tell them about their kidneys. Did you know you have 2 of them? And I talked to them about what they do. Of course, the kids think it's so funny whenever you talk about pee, and, your kidneys filter your blood and they make pee. And, they just, they giggle and laugh. And but what I described to them is I asked them, I said, how many of you have ever seen a duck floating in a lake or swimming in a river, and most of them raise their hand, or even if you've seen it on TV, how many have you seen? And they look so pretty, and they're gliding across the water. And I said, but what you don't see is their feet under the water going 100 miles an hour, just flapping, 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 flapping. And so they look totally normal on the top, on the outside, but underneath, and I told him, I said, it's like the kidneys. Those feet underneath are like the kidneys, and they're working so hard just to keep up a normal life. And I said, people with kidney disease, their duck's feet or their kidneys are flapping even harder than yours. And so it's this visual for kids because they know what a duck looks like. Yeah. Floating on a river. Think of the Guadalupe, right? Just a beautiful river near you in Kerrville, but what you don't see underneath is that these kidneys are just working so hard, double time, triple time, just to make that urine and filter that blood, right? So that you can live somewhat of a normal life. And so, when you talk to children and you're educating kids and I want to say even adults, sometimes if you break it down in these little components, they're like, oh, I would get emails back from parents that next day or two. And they were like, we had the most interesting conversation at dinner tonight. Luke was telling me about how he has 2 kidneys and he learned what these kidneys do. And he told me about the duck gliding and how the feet were the kidneys. And, it was just a really powerful moment. And I thought, you know what? If these kids can take away knowing a little bit more about their body and how it works, it's so, so important, for their future and understanding that sometimes what you see on the outside isn't always the whole picture, right?
That's right. Exactly
And,
right.
And so that's, you know, and that's kidney disease. That's kidney disease.
And there are a lot of adults who don't even know they have it, and the ones that are just learning about it are just like kids, no clue.
You know, Kent, over 40% of people who have severely reduced kidney function do not even know they have it.
30 million.
Over 40% don't know.
Yep.
Because these symptoms, like we've talked about, are pretty vague, and no one pays attention to what their pee looks like, right? You know, and so it's something that, you know, NephCure and many other advocacy groups and people like you out there teaching and talking to people, so maybe they do pay attention a little bit more. You know, you increase awareness, you increase knowledge, then you increase the people who, their perception of what's going on with them. You know, we've got a major problem in the United States with kidney disease, major problem. And it's podcasts like this, it's the people who listen to podcasts like this that understand and are wanting to know more. And that is so important.
There's with your son now, I don't want to predict anything, but he's going to move on. This is not going to be cured. His MCD's always, you know, there are some things that go on. I don't want to get into those things that could happen. We're going to go day to day here. We're at a stopping point with MCD for your child right now, because everybody's different, but there's no need speculating what can come. You have to stay the course out there. You have to stay going to the nephrologist, stay on course with that. I call it staying in your own lane, making sure you go to the doctor with that child and make sure he's getting the best. Because what you explained or what you told us about his care is standard for just about everybody. And that's why we say, you know, we need more research. We need more emphasis on kidney education. All right. Especially in the pediatric theater.
That's right.
That's where it needs to be. So let's leave your son for right now and say, you know, you just keep on trucking, do what you need to do, and everything is it's gonna fall into place because you're getting good care. And that's what we need to leave with. But then let's go on and say, I want to ask you, because you're right in the fight, what I call right in the arena of kidney research at NephCure.
Mm-hmm.
I had experience early on several years ago working on the registry program. And so NephCure essentially works in the realm of nephrotic syndrome with an emphasis on FSGS and all the diseases in nephrotic syndrome. Mm-hmm. Explain to me what you do and what the function of NephCure is and where we're headed in kidney disease.
Yeah. So, you know, just to give you an idea, you know, NephCure, the mission, right, is to accelerate research for better treatment options. We at NephCure believe that steroids should not be the main treatment. You know, we believe that the clinical and genetic and medical research and innovation that's going on right now in nephrology, because nephrology is in a boom, Kent. I mean, we are where I want to tell you, like, cancer research was even 20 years ago. So nephrology is a little bit behind in this research and innovation, but it is here now. And so we know that there will be better treatment options than just high-dose steroids. Will high-dose steroids always be around? Sure, they will.
Absolutely.
We know that there's more out there, and we know that with the research that's going on, there will be better options for people. So better treatment options through, you know, advancing research. And then another part of NephCure is really supporting and educating the patient community. These go hand in hand, to be honest with you. Just like we were talking about, you know, the more that you know, the more you can self-manage, the more you can manage your own health and health care, you can be an advocate for yourself. You know, like I said, in my son's journey, I didn't know what was going on, but then I immersed myself in knowledge. I immersed myself in educating so that I could know more, so that I could help manage him better, so I could be part of that healthcare team, right, for him. And so I joined the NephCure staff in late 2019, September 2019. And my role, I came in as the director of clinical outreach. I still hold that position today. And really the focus of my job is to develop patient-centric educational content. So resources, whether it be resources, helping organize and resource information on our website, whether it be downloadable one-sheets that you might, be able to find on our website that you can download and hand to your family or friends, or the teacher maybe that your child has, or so they can understand more about the disease or the condition that the patient has. And then I also lead webinars. So COVID, happened pretty quickly after I started at NephCure, and it really pivoted a lot of NephCure programming, obviously, into a more all virtual format. And so this is, I think, where I was able to really dig in and show my passion for health education. So NephCure U is kind of a play on NephCure University. It's for patients and caregivers to come about once a month and learn more about different diseases, conditions. I had one recently, on adrenal suppression. We know that a lot of times people who are on chronic steroids have adrenal suppression. So sometimes they're disease specific, like on MCD or on FSGS, and then sometimes they're a bit more broad. And then another one that's been really popular is on Facebook Live on NephCure's Facebook page, and there are chats with Nurse Kristen. And it's really me just going on there, random times. It started off maybe a couple times a month. It's gone down to about once a month, but I just get on there and I talk to people. Usually I have kind of a topic, and I talk about the topic of the day, whatever it is that might be, on my mind. Maybe it's COVID, maybe it's vaccines. I listened to your plug for vaccines, and I have to say, Kent, it's so important to continue that messaging. There's still a lot of people out there, that don't know if they should get it. They're concerned, is the vaccine going to hurt my kidney function? And what I tell them whenever they reach out to me is, it's a risk-benefit ratio. If you get COVID, if you get infected with that SARS-CoV-2 virus and you get COVID, you could have detrimental harm to your kidneys. I mean, a lot of these people that are in the hospital with COVID, right, they were on dialysis, and they continue dialysis even if they live through it, and so it could kill the kidney that you have altogether. But if you get the vaccine and you spill protein for a few days, the anecdotal data that we've seen so far is that if you get the vaccine and you do spill some protein, most of these patients are resolving it on their own within 3 or 4 days. So it's kind of risk benefit. Okay, so do you want to keep the kidneys you have, or are you going to risk losing them and risk getting COVID? And this could be taking your life as well. I mean, this, especially with immunocompromised, and you're talking about transplant patients. I mean, these are vulnerable patients. And so I appreciate the messaging around, getting a vaccine. I've done a lot of that myself through NephCure. So where we are with NephCure as far as treatment options is, about 5 years ago, there were only about 2 clinical trials out there. And today we are at about 30. So about 30 different clinical trials for nephrotic syndrome, diseases that encompass nephrotic syndrome. So FSGS, even there is now one for treatment-resistant minimal change disease. This is the first clinical trial for minimal change disease patients. It's huge.
Yep.
C3G, IgA nephropathy, membranous nephropathy. So a lot of these diseases that have nephrotic syndrome, there's a lot of options out there. There's a lot of stigma around clinical trials too. And
Yes.
so we try to break that down and really make patients understand that patient safety is always number one, period.
I wanted to interject one thing here about clinical trials.
Mm-hmm.
After 34 years of transplant, living with my brother's kidney, I apply for everything that comes across the board.
Yeah.
And the first thing they ask you, have you been transplanted? And of course you say yes, and you're out.
That's right.
But there is for all the transplant patients listening, if you go on your website, NephCure's website, there are clinical trials for transplant patients.
That's
okay.
Correct.
So that is something I wanted to get across. Now that I've ruined your train of thought, why don't you keep going?
No, that's it. I think that's perfect, because that's what I was going to mention is that, for so many years, there was nothing for transplant patients.
Mm-mm.
And now there are multiple trials for transplant patients. There even, if even those that are going for their first transplant, there are trials for them.
Yeah.
So people are under medical professionals, medical clinical researchers are realizing that number one, transplant is not a cure, and that a lot of times these people need better treatment options also. It's not just for the ones who haven't gone through dialysis and transplant. Everyone needs more options in kidney disease.
Absolutely.
So, yep.
It's the key to success in kidney disease is options. Because you mentioned being your own advocate. You can't be your own advocate unless you get options from your physician. They give you options 1, 2, 3, and 4. Then it's up to you to make the decision, not them. So it's very important for you as a kidney patient, whether it be CKD, on dialysis, or a transplant patient, you're in charge. And you better get up to speed on being in charge, because we don't want somebody else running the show.
That's right. And that is so important. I call that patient activation. I don't know if you've heard that term. Patient activation is when a patient has the knowledge and the skills and the confidence that they can, it's like an empowerment, that they can help make decisions. They can advocate for themselves. And so that's another piece of what NephCure is doing in this rare kidney disease space, because we want patients to know you do have options. If your doctor isn't talking with you, not to you, but with you, if it's not a dialogue where, like Kent, you and I are having a dialogue where we're sharing ideas and exchanging information with each other. If it's a one-way lane where the doctor is only telling you one thing, it's not collaborative. That's not helpful. You have to have a doctor that will talk with you, is accessible to you, will have information exchange, will listen to you. I don't know if I really want to do that.
And okay. That's okay. That's okay to say, Kristen. Yes. That's okay to say.
Absolutely. Absolutely. And as a nurse, I have to say, nurses are a lot of times, as you know, the ones who are with the patients the most. Yep. And so if we can teach patients to, here's some questions to ask, because I don't know what questions to ask. Well, let me arm you with some questions so that you can look at these. What do you feel comfortable asking? Sometimes it's baby steps, because, some people see doctors as this ivory tower, white coat,
Still today.
It's still today. But we have to break that barrier. And I think a lot of the nephrologists that NephCure works with closely, a lot of the ones that were in our patient summit yesterday, we came off this amazing virtual patient summit yesterday. A lot of those physicians enjoy dialogue. They want to hear from the patients. They know that the voice of the patient is valuable, because their journey is valuable. It's not It's not a loss. We have to learn from each other. And so it's really important to know that you can be empowered to take control. And it's important to do that.
You're so right, because again, you look at how a life goes, it's always got bumps in the road, regardless. You're not going to find an easy track. There's always going to be bumps. Kidney disease is a bump. And if you get to a bump, you've got to get over it. You get over it by learning about what it's all about. You get focused on you and focus on what it is that can help you.
That's right.
Not the individual. You are the one that makes the difference. So
that's right.
We work with patients all the time that say, well, I don't know how to do that. At one point in time, since this virtual thing's gone on, I have been able to accompany on a Zoom call a couple patients with their doctors. And
that's amazing.
That has given me great joy, because I'll say, well, Ernie, weren't you going to ask him about, oh yeah. Okay. Well, those kinds of things are real important, because that gives them hope that, what, I can do this. I really can do this.
That's
and
right.
A lot of the doctors are open to this. It's not a problem. They're so busy, they say, but they'll take the time. If you got an audience with them, if it's important enough to bring somebody along to help you, they're going to listen.
I totally agree. And I do think that what I have realized in my care circle, in not only in my son's care, but in the nephrology community in general here in the United States, I feel that they are very compassionate doctors.
Oh yeah.
A lot of them went into nephrology, it wasn't their intention, and then they fell in love with it. And then knowing the intricacies of what the kidneys do to help your body just stay in that stable state, that homeostasis, right, was what we call it.
Yeah.
They realize that what the patient experiences is really important to be able to know, so they can help them through the whole process. I tell patients, understand deeply, whatever that means to you. If it means, do you need to know more about your disease, minimal change disease, then understand that deeply. If you need to know more about the medication that you're on, then understand that deeply, so that you can understand the path that you're on. And you know what? We all fail at some point in time. We may forget our meds, or we may go through a spurt where we're not eating well, or we're not exercising, we're not taking care of our body the way we are. But you know what? If you understand deeply what you need to do, you'll get back on track. You stay in your lane. Like, I love that you say, stay in your lane.
Yeah.
Sometimes we might merge out of that lane, but get back in that lane. You know the right path.
Right. That's your path. Yeah.
It sure is. It sure is. And I think it's really important. And I love the fact that you help other people advocate for themselves. And sometimes it's a gentle reminder, just like you said, did you want to ask about this? It's perfect.
Another thing I've found too, that I think extremely important, is some people don't want to go there. You know what I'm saying?
Yeah.
They're in their lane, but they don't want to go there. They don't want to they just don't want to yet. They're not ready to go there.
That's right.
So then you got to leave them with this idea that you're always there and the doctor's always there. So really, you've got to get in order some way. You've got to come to the realization that this kidney disease is lethal. And when you do that, you come back and you talk with me. And in the interim, I'll call you just to check on you.
It's absolutely right. And I think that what you're touching on is, is a piece of mental health that is hard, because you can't change that person, right?
No.
But you let them know, we're here.
Yes.
I'm here.
Yes.
And when you're ready,
we're ready.
I'm here.
Yep.
That's right.
Yep. And always will be here until I go. I've said many times, my last breath will be drawn working with kidney patients. So there you go.
That's right.
Now I want to, before we go, I was amazed at how well that NephCure summit went yesterday. Now this is this is May 17th, 2021 or 18th, whatever. The summit was yesterday, the 17th, right?
Yes, it was yesterday.
Yesterday. Okay, so you can go on NephCure.org. Tell people how they can actually get in and review some of this stuff that we talked about yesterday. There was a tremendous amount of information. I don't want the listeners not to go away not knowing how to get in there and listen to some of this stuff. It was amazing.
Man, absolutely. There's something for everyone. We came off from yesterday. We came off of this amazing annual patient summit is what we have. And this year, for the first time ever, it was completely virtual, obviously. And we had over 178 patients attending. And there were sessions for everyone. If you are a transplant patient, there was a session for you. If you are a dialysis patient, there was a session for you. If you are a patient who has, if you are a new patient, newly diagnosed, there was a session. I mean, there was something for everyone. So if you're interested in listening to some of these sessions, you can go to nephcure.org. It's NephCure.org. And right there in the front, there's a big banner that says Patient Summit, right on that head, that main page. And if you click it, even if you didn't attend or register for it yesterday, you can still do it.
Yes.
And starting tomorrow, Tuesday, May the 18th, all of the recordings will be accessible. So, you register and it'll ask you what's your password. Well, guess what? If it's the first time, just enter a password that you want to remember, and you can go back in there and you can access all of those sessions. I do also believe they will be uploaded to our website in the future, but right now you can still access them all through that platform that was used for the virtual summit. It was a great day.
Oh, it's great. Absolutely wonderful. I missed out of this with the community part of it because my connection was really bad, but I'll go back and listen to that.
Yeah, I did. I have to say, I did introduce you because I saw your connection was bad. And so I told him, I said, that's Kent. I said, he is in Kerrville, Texas. He's a transplant, warrior from FSGS 30 years ago. And anyway, so I told him that you were a big advocate for kidney disease. Even though you weren't there, I introduced you, Kent.
Thank you very much, Kristen. I want to tell you, here's just some of the topics that you'll hear about. And there's something for everybody, like Kristen said. Newly diagnosed patients, C3G, parents/caregivers, pediatric dialysis/transplant, adult dialysis/transplant, membranous nephropathy, adult dialysis, and transplant patients. It goes on and on and on. And all you got to do is click, and then you get 60, maybe as much as an hour of really good sound advice and information. So go to nephcure.org and do just what Kristen said.
Yeah, completely free.
Absolutely. Yeah, no strings attached, just like Kidney Solutions. We do it all for free. Okay, right. Kristen, I always give everybody their last shot. Here's your last chance. Did we miss anything?
No, education's key, Kent.
Absolutely.
Education and advocacy is key, and get empowered, whatever that means to you, whether it's building your knowledge or building your ability, or strengthening the confidence within yourself, because we know at NephCure and Kent knows at Kidney Solutions that you have the power to take control of your disease and to help make change. And the change is here, and we are here to support you in whatever way that you need.
Kristen, if anybody in the NephCure world that wants to come on, I'd be more than happy. You talk to them about what our experiences was here today, and I'm available. And I'm going to have you back. And blessings on your son.
Thank you so much, Kent. Thank you so much.
Okay, folks.
It's been great.
Yeah. Okay, listen, folks. It's hard to stop. I want to keep going, right? I got things to do today. Kristen's got things to do today, and you got things to do today. One of the things you have to do is remember that you're in charge. if you're a kidney patient right now, if you're newly diagnosed or if you're long-term, you're in charge. And if you aren't in charge, you got to get there. And Kidney Solutions is here for you. NephCure is here for you. NKF, AAKP, you name all the kidney organizations, they're there for you. And all you got to do is click on them. Go search them, Google them, but learn about what's going on with you. And if you're unsure, give us a call at Kidney Solutions. Until the next time, keep breathing.